welcome back to Rohrich Knows Podcast, helping you become a better and more educated you. Well, AI is all over the place. AI is going to, probably transform, it is already transformed medicine, and is it going to replace us? We don't know. So I have a world expert plastic surgeon, Dr. Alfredo Hoyos, who really has taken a deep dive into AI and has really done some amazing, amazing things. And he's going to tell us a little bit about how we can use AI, how we can make it better, and how we can actually enhance patient care. So Alfredo, welcome.
Hello, Dr. Rohrich. Thank you very much for having me once more. Thank you very much for the invitation this time.
You bet. And Alfredo Hoyos is a world expert in body contouring. His innovative techniques and technology have taught thousands of plastic surgeons around the world on high-definition liposuction. So let's get into it. So AI, we all love it. I love AI. I love ChatGPT. So how have you used it as an educational tool and then also as a safety tool? Tell us about that, because I just, was at your meeting recently, and it was amazing what you've done in such a short time period.
Yeah, so we have mainly two fields that we're working on. And I think one of the things that we have to be very clear is that one thing is to ask ChatGPT about a nice restaurant or recipe or something like this. But another different is to ask them for advice in a medical field. And what we know also is that resources that ChatGPT can have may not be reliable in basis. So for instance, I always recommended one that is called open evidence. Open evidence is actually medical grade and actually looks for the sources in medical journals. So we have like a more reliable source in that. And it's very, very important that we actually know this as doctors, because we think that the oracle are these AIs, but they can have different sources that are not going to make it good for you. So having that in mind, what we design is a way that we can educate an AI. This one is called Aurora. And Aurora, as Aurora is literally the dawn or something. The idea is that it becomes like the guru of the plastic surgery. We have been training her in specifically body contouring, facial, nose, and now in breasts. So it is still in the process of doing machine learning. But one of the keys is that we can interact with her as a normal person. Right nowadays, we have it as a literally like an animated figure, and you can literally have a chat with her, in real time. The idea is that we can either combine it in a more realistic way. I don't like to make it too real because it's going to confuse the audience, but the whole idea is to have like reliable sources, both to educate surgeons in new techniques, in new devices, in new technologies, but also a resource for medical education for patients as well. Something as simple as, how long should I take this time off for doing this liposuction? How long is going to be the recovery? What can I eat? If I'm allergic to this, can I try this food, for instance? Can we mix these medications? These kind of basic questions that actually can complicate patients. And sometimes they don't have, the access to the surgeon right away. So something that actually can be reliable at the same time that can be immediate for both surgeons and patients.
And the key is, and you mentioned this, is that you have to educate it. It's a tool that you have to help ask the right questions, but also keep educating it, because it'll grow upon what you ask it, right? And I think that's very powerful. Exactly. And so you've developed this AI tool for body contouring?
So we began as a tool for doing body contouring and literally answering the common questions that maybe patients or surgeons that actually are new to new techniques and stuff would have.
Okay, so let's jump into the next one about safety, and you demoed that at your meeting in Cartagena. So tell us about that, which I think is really good. I think it could transcend not only body contouring, but everything from facelifts and rhinoplasty. You say, hey, show me how to be safe, or what are the things to look for. So tell us about that.
Yeah, the thing is, it has been an advent of safety, and we have been part of a team that has been doing a lot of research in terms of safety, specifically for body contouring, because body contouring is one of the most risky surgeries, especially in bleeding, especially in having a lot of like nuances that can increase or diminish the probability of having some complications.
Right.
So having that in mind, one of the things that we are actually behind is that the widespreading of this information is not good. So some surgeons are like 10 years behind. Some others are like now up to date in this type of prevention systems, And the idea was to create an app. The app is called Lisa. So it's like Perception Safety Assistant. Mm-hmm. And she was nourished with components of safety as well as nourishing with your own data of patients, Okay. So for doing machine learning, to doing a good machine learning, we have to start with 500 patients. So we actually had to do lab tests before and after and compare them and say, okay, Lisa, tell us, what are the parameters here that can actually make a surgery safer? So having that in mind, when we completed the 500, we only had 85% of reliability, So we had to expand it to 1,000 patients. So It has been in the works for some time already, And having that in mind, the idea is to tell the doctor, okay, these are the follow rules, these are the rules that you have to follow or have in mind before doing the surgery and having less bleeding, for instance, Mm-hmm. So use of tranexamic acid, the hypothermia prevention, not spend too much time in the surgery, doing a reliable surgery. So with that in mind, we created Lisa. Lisa is an app, you can download it in the App Store for both for iPhone and for Samsung, for Android devices.
Right.
And it's called Lisa app, safety app. And the idea of Lisa is you can even talk to her if you are in the middle of the surgery and say, oh, Lisa, you can actually push a button and talk to her and ask her, okay, how much can I extract of this patient? And she actually need a basis of very simple simple things that are maybe 5 things. Needs to know the age of the patient, gender of the patient, the initial hemoglobin, and the hemoglobin that you want at the end of the case. Okay. Usually it's 10. Okay. But with that in mind, it can tell you the amount of fluid that you can get in, the amount of tranexamic acid that you can get in, the amount of bleeding that the patient might have, the risk of this patient in thromboembolic events. And it can tell you mainly how much we can extract out of a patient. That is the big question when we're doing liposuction, especially in big patients. We don't know, And usually the amounts that we have fixed, it in the United States, to state is completely different. In some states, you can extract 3 liters, in another one's 4 liters. If you do something else, it's just 1 liter. But it is not very good science behind it. So this is an accurate, very, very scientific way to know this exactly with the data of every single patient. So we are very glad to announce that this is going to become a game changer in terms of safety for our patients.
Yeah, and talk about not only patient safety, but recording outcomes. I mean, it's amazing, and it keeps getting better. Wow.
Exactly.
And it's kind of like having a bunch of good help, right? It's reliable.
Yeah, and that's the whole idea. It's like having the data of thousands of surgeons to your service in order to say, okay, this is, this amount of surgeons actually did this and it actually worked better for the patient. You should do this, So, or, you can analyze also your own cases. If you put the input of your data of your patients, or later you do a blood test afterwards, you can trace your own patients. Lisa can, in big data, tell you, okay, maybe you should do this instead of that. And maybe you can, so you can do a little bit more abstraction. And so on. And the idea is to nourish it with more data and also with more factors. What is not a liposuction? It's just a breast augmentation, a breast reduction. What if it's a facelift? What are the indicators that actually will tell you with big data to predict what is going to be the risk of the patient? And let me tell you this. The thing is, we think we know the predictors, but as we nourish this AI with big data, she can maybe find relations with things that we don't even thought about ever.
Yeah, and I think that's the beauty of this, because it's machine learning that really gets better with this. So is it available now? Is it an evolution? Is it available?
Yeah, so it's already available now, both in iPhone and both for Samsung and Android devices.
So, and we'll put that caption in exactly on how to get a Lisa and some. So,
yeah, you just book Lisa Safe app and it just goes there.
Lisa Sevap.
And he's a beautiful brunette in the.
I
in the
know,
image.
I know. She was all over the meeting every morning, on WhatsApp and everywhere. It's great. No, it's beautiful. Well, a lot of amazing innovation happening. Whatever Dr. Hoyos gets his hands on it, it turns to gold because it's great about safety, outcomes, and doing the right thing. So thank you so much again for giving back and really helping to bring body contouring and safety to a whole nother level of excellence. So I appreciate all your time, Alfredo, and until next time.